Yes, once again, good afternoon, everyone, and welcome to our event on celebrating the World Health Day. My name is Aisha Titidola Kazim. I am the program manager for Center for 21st Century Issues. It is my pleasure to welcome all of you today to our event. So, as we all know, today is World Health Day, and we have seasoned speakers who are experts in the health sector. We've gathered them today to have a conversation around the health system and the changing climate. So I would like for us to introduce ourselves shortly in the chat box so as not to waste our time, and I will give us a rundown to how the program is going to run. So we're going to have presentations from the three speakers. They have 30 minutes each to give us their presentation, after which we go to questions and answers and contributions from all participants. Then we close. So without wasting much of our time, I would like to quickly give us a few overview. We all know that hundreds of millions of people across the globe are suffering from the impact of climate change. And then this ranges from extreme weather events to disruption in food systems and even health systems. So, and today that marks the occasion of the 75th anniversary of the World Health Organization, the Center for 21st Century Issues gathered experts to reflect and discuss on the health systems in the era of a changing climate and propose actions that is needed to address the challenges and also to strengthen the health systems to continue to be efficient and respond to improve population health in an unstable and changing climate. So I would like to invite Ms. Akosa. She's the Executive Director of the Center for 21st Century Issues to give us her opening remarks. Ms. Akosa, you're welcome, please.
Thank you very much, Titi. I hope everyone can hear me. Hello, can you all hear me?
Yes, we can.
Okay, thank you very much. You're all welcome to this event. I want to appreciate all of you for finding time, especially during this festive season. We are really sorry for having it because today is the 7th of April and it is the day earmarked for the World Health Day. So there was no way we didn't want to change it. So just like I said, welcome everyone. And we are going to be discussing health system in a changing climate. We all know that climate change is the defining issue of our time. We know climate change can disrupt so many things. The impacts have been so encompassing in different sectors. But today we are going to be looking at what climate change is doing in the health sector and what is the kind of solutions that we have on the table to address it. I know several organizations and institutions, even the UNFCCC, have tried to deal with the issue of health and climate. But then, how does it connect, or how does it happen? What is the reality on the ground in Nigeria and in elsewhere? Because I know so many people are joining us even from outside Nigeria. And as civil society actors, what can we contribute to addressing the impacts of climate change in the health system? We know all the different sectors of health, which is water, sanitation, are affected by climate change. Even the issue of food, our food system, everything is affected by climate change. So as practitioners on ground, as those who actually want to make a difference and find solutions to the issue of climate change in our countries, what is the reality on ground in our countries? What are the solutions that people have applied? What is working well? What is not working well? And as civil society, what should be our role in ensuring that people understand the impacts of climate change on our health system? And what can we do to strengthen our health system to be able to address the impacts of climate change, we are now beginning to think around a resilient health system. What would a resilient system mean to a changing climate? These are some of the questions that we will really want our speakers to really answer. And I know that they have their different subtopics they are going to speak to concerning health and climate change. So you are all welcome, our speakers, and I welcome you again, once again, to this program. And I believe that all of you are going to learn new things that you are going to take back to your work. Thank you very much. You're all welcome.
Thank you very much, Mr. Kosa. That was a wonderful one, and it has given us, it has opened us to what we have to discuss today. And then I would like to invite the speaker now, Ms. Dr. Ayodotun Obadoye, who is going to be addressing the ecological determinant of human health system, human health and ecosystems. But I would like to quickly give us the profile of Dr. Ayodotun Obadoye. So Dr. Ayodotun Obadoye is the Chief Operating Officer of GET Consortium. That GET Consortium is the Global Emerging Pathogens Treatment Consortium from 2016 till date. He is an Associate Professor of Environmental Biosecurity at the Forestry Research Institute of Nigeria, FRIN. He was also a research officer at the African Technology and Policy Studies Network, ATPS, in Nairobi, Kenya. He is a scholar of the Woodrow Wilson International Center for Scholars, Washington, DC, and a scholar of African Science Service Center on Climate Change and Adapted Land Use, WASCA. He has a BSc in Animal Science from the University of Ibadan, Nigeria, MTech, Animal Production and Health from the Federal University of Technology, Akure, Nigeria. He has Executive Master's Project Management from the Project Management College, London, and a PhD in Climate Change and Adaptation from the Institute of Climate Change and Adaptation, University of Nairobi, Kenya. Dr. Ayodotun has led many internationally funded research projects bordering on biosecurity, One Health, climate change science, technology and innovation systems, development issues, policy development analysis and advocacy, epidemiology, and private sector engagement. He is a member of many professional organizations and he has published over 60 articles in reputable journals. Please join me to welcome Dr. Ayodotun Obadoye, who will be addressing the ecological determinant of human health and ecosystem. Dr. Ayodotun, you're welcome. Please, you can share your screens. Thank you.
Thank you very much, Mr. the moderator, for that very kind introduction. And I say good afternoon, ladies and gentlemen. I bring you greetings from Global Emerging Pathogens Treatment Consortium, my organization. And we are so happy to be part of this very important webinar. I also say thank you to the MD of 21st Century, the organizers of this webinar. Thank you for inviting me, and I'm very glad and happy to be part of this webinar. I hope you can see my slide.
We can.
Yeah,
okay. Yeah. So this afternoon, briefly, I'll be speaking on addressing the determinant of human health and ecosystem. Like the MD of the organizers of this webinar said, climate change is a very important issue in our world today. In fact, it's one of the biggest pandemic that's facing us in our world today. And the scary thing about the pandemic of climate change is there's no vaccine and there's no drugs that you can use to cure it. That means everybody has a part to play to make sure that we contribute to either adapting or mitigating the impact of climate change. And I always, when I talk about climate change and health and issues like that, I always like starting with the mother heart itself. The heart is a giver of life, is a giver of health, and it has its own life itself. Every living organism, from the most developed organisms, human beings and primates, to the single organisms like amoeba and other single organisms depends on heart for existence, for survival, for health, and vitality. And for us to effectively enjoy the planet which God has given us as humans, we have to start taking care of the heart itself. If we will not protect and take care of the heart, then the heart itself will not guarantee the existence of human beings. So as we talk about health today, as we talk about taking care of humanity today, we should all have it at the back of our mind that the best way to secure our health, existence, and longevity, not just for this generation, but for generations unborn, is to take care of the planet's heart and treat the planet's heart well, so that the earth can sustain us and generation that is yet unborn. We're talking about determinants of health today, and we have different factors that determine the health of human beings. We have both the genetic factors and the phenotypic factors, the external factors and factors that are determined by the gene of individuals. And some of these factors are listed here. We have nutrition. And man is only as healthy as the food he eats, and the kind of diet it takes. We have the lifestyle, the daily routine and behavior of humans. We have the environmental factors, that's global pollution, climate change, and everything that is around us. We have the kind of medical care we have access to, the drugs, the medical service, and other medical care that we have access to. And we have the genetic makeup. That's what makes up every human being. Science will always tell us that we are a product of our genetic makeup and our phenotypic makeup. The two put together is what determines the health and vitality and longevity of humanity on health. But today we are focusing more on the ecological determinants. Those are the things around us, the environment we live in. And basically the economic determinants of health are surrounded around three major factors or three major elements: the oxygen, the air we breathe in, the water we drink, and the food we eat. These are the three basic things that affect our ecological or the ecological determinants of health. And anything that affects the oxygen, the air we breathe in, that affects the water we drink, and affects the food we eat will definitely affect our health, our wholeness, and vitality. And that is why we are going to be looking at factors that affect these basic things and how we can effectively address those factors today. And one of those factors, like the earlier speaker have said, is the issue of climate change. The Lancet said climate change is the biggest global health threat of the 21st century, because climate change affects every aspect of human health, directly or indirectly, either through the food, the water, and the air we breathe in, or indirectly through affecting other determinants of health. For example, the impact of climate change on emerging infectious diseases, the impact of climate change on extreme weather events that leads to floods and drought and every other thing that affects the quality and the quantity of food we eat. The impact of climate change on increasing temperature, affecting human beings directly and indirectly, even affecting vectors of diseases. Now we have diseases that never used to occur in relatively cold areas, diseases like malaria, like dengue fever, and other forms of disease that we never used to experience in relatively cold areas, because those areas are becoming warmer. We're beginning to experience such diseases. Extreme weather events leading to injuries and other forms of disease, of illness, and temperature affecting mental health. So climate change affects almost every aspect of health. And like I used to tell people, the main reason why climate change is important is not because climate change is an environmental issue. The main reason why climate change is important is that it affects human health either directly or indirectly. So when we think about climate change, when we talk about climate change, we should not just see rainfall and temperature increase and drought. We should see the impacts, overall effects and impact on the health of humanity. When we have excess rain, how does it affect food? When it affects food, how does it affect humanity? How does it affect the kind of diseases, locusts, affecting plants that in areas that they never used to experience such impact, effects on emerging infectious diseases, drought, desertification, and all these complex transdisciplinary actions caused by changing climate. So we have to understand that this issue of climate change is here with us, it's here to stay, and we all have a role to play, directly or indirectly, to address this emerging challenge that is affecting the whole world. So the first thing is the ABC of climate change. What exactly are we talking about when we talk about climate change? Simple geography, climate change is the average, is a change in the average weather condition of any area over a long period of time, which is minimum of 30 years. But the truth is that this is not the first time the climate of the world will be changing in the history of mankind. History of paleoclimatologists have talked about the Holocene period, talked about the Pleistocene period, and different periods of changing climatic conditions. But the problem is that the period we're living now is called the Anthropocene period. And that is a period where the climatic changes as a result of human activities. Human activities over the years, industrial period, is affecting the climate of the earth by releasing greenhouse gases that have been released since around 1800, when industrialization started. These greenhouse gases, the carbon dioxide, the nitrous oxide, the methane, and other greenhouse gases have the effects or the ability to reabsorb heat that is leaving the earth's surface and re-emit it to the lower earth surface, causing gradual warming of the earth that will call global warming and affecting the climate of the earth, causing what we call climate change today. And because we depend on nature for a whole lot of activities, especially in sub-Saharan Africa, about 80% of the food we produce is rain-fed. The impact of this changing climate has severe impacts or effects on us in this part of the world. It affects the food we eat, it affects the water we drink, it affects the way we live our life. And the challenge is that climate change is not like COVID that will affect the world for 3 years and will live with us. Climate change is what has come to stay and what will live with us and live with the generation yet unborn. In fact, the truth is that generations yet unborn will feel the impact of what we've done more than what we're feeling now. So we all have a role and a responsibility to contribute to adapting to this changing climate and see what we can do to contribute to reducing our carbon footprint and reducing the amount of greenhouse gases that will release into the atmosphere. We have several research and several scientific different research to show that the climate is really changing. And this chart is just one of the research of the trend of changing rainfall anomalies in Africa from the year 1900 to 1990, showing clearly that in recent years, in the last 10, 20, 30 years, we started seeing significant drop in the amount of rainfall in Africa. And you agree with me, for a continent that has about 80% of its food production depending totally on rainfall agriculture, this kind of reports and this kind of analysis is very dangerous to Africa. And we are beginning to see this impact in different countries in Africa. Countries in East Africa, like Ethiopia, like Kenya, like Somalia. In the last 4 or 5 years, have gone through constant drought and constant loss of sources of food because of severe droughts, dry spell, and abnormal rainfall. Other aspects of how climate change affects the ecological determinants of health, especially in Africa, it affects the water quality and the water quantity. We've seen it in Nigeria, especially with Lake Chad drying up, losing almost 90% of the water content. And we've seen the impact of that on different aspects of our economy. We've seen the impact on the livelihoods of people that live around that place. We've seen the impact of insecurity, seen the impact on the health and survivability of people that live around that lake. And not just Lake Chad, many other water bodies in Nigeria and different parts of the continent. Research shows that water quality and quantity, climate change will contribute to doubling of the people living in water-stressed basin. By the year 2050, that means we have more people struggling to have access to clean and quality water. By the year 2050, in fact, we're already having that challenge, and we've started seeing increase in water stress and insecurity and water-related conflicts in different parts of the continent. Also food security. In some African countries, yield from rainfed agriculture may have by the year 2025. And we've already started seeing it in Nigeria, we've seen it in many other parts of the continent, especially in dry areas of East Africa and Southern Africa. Also in Nigeria, research has shown clearly that the desert is moving southward at about 300 kilometers every year. And we can see areas that there were savanna areas in maybe 40, 50 years ago in Nigeria becoming dry areas. And as the weather, the dry conditions continue to move southward, we've seen more challenges of people rearing their cow, as their sources of livelihood, also moving southward in search of better environment to feed their cow. And we've seen this leading to increase in conflict between herdsmen and farmers and many other forms of challenge relating to this, each of them trying to maintain their sources of livelihood, and this causing severe conflict between different kinds of different humans trying to just survive and maintain their sources of livelihood. So this impacts, these environmental changes have been severe impacts on us, affecting sources of livelihood, causing conflicts, affecting health, and affecting different areas of health directly and indirectly. What of impact of climate change on infectious diseases? Like I said, we have now colder areas where mosquitoes were not able to breed before because the environment is getting warmer. We are now seeing mosquitoes and other vectors breeding in areas where they never used to breed because the environment is now warmer and more comfortable than it used to be. And research has shown that malaria will put about 90 million more people at risk in sub-Saharan Africa within the next 10 years. So all this shows the clear impact of climate change on health. And this chart, I believe some will have seen this chart. It shows the impact of climate change on different areas of health. You see severe weather causing injuries, fatalities, mental health, and other issues. We have air pollution causing asthma, cardiovascular diseases, change in vector ecology leading to increase in malaria, dengue fever, Rift Valley fever, and other forms of vector-related diseases, increasing allergies, water quality and quantity, leading to increase in diseases such as cholera and other forms of water-related diseases, environmental degradation, forced migration, civil conflicts, mental health, extreme ills, heat-related illness, cardiovascular failure, death, and mental health. So this shows a summary of impact of climate change on health, and it shows clearly that climate change affects almost every aspect of human health, whether directly or indirectly. Another determinant that we're going to be talking about briefly is air pollution. Air pollution is one other issue that is severe in our country, especially in Nigeria today, affecting humans because pollution is increasing, especially in our cities, through generators, through pollution from our cars on the road, through pollution from minings and other forms of natural mining that we do in the country and also on the continent. And I show that cancer are attributed to air pollution, and 24% of all stroke deaths are attributed to air pollution. It shows clearly the impact of air pollution on the health of human. And this is a picture taken somewhere in Lagos. You can see how almost every car is releasing serious carbon the environment and people on bikes and others are inhaling directly the poor polluted air from the cars that are driving on our streets. One other issue that we have is deforestation. Deforestation is one other environmental factor that's having severe impact on the health of humans, especially with increase in emerging infectious diseases as human beings continue to destroy our forests and move into new animal territories, and animals too moving away from their destroyed territories for better place to animals, either personally or through the water we drink or the food we eat. And as humans and as contact between humans and animals increases, we'll see the impact on increase in frequency and intensity of emerging infectious diseases. Because the truth is that the forest is a natural habitat of thousands, if not millions, of dangerous pathogens that we know little about. And as we move into this forest, we are exposed to these pathogens, and we've seen increase in zoonotic diseases in recent years, especially in sub-Saharan Africa. Most of the diseases, emerging infectious diseases we're seeing today are from animal sources. Most of them are from wild animals, either Ebola or Lassa fever or COVID or HIV/AIDS. Most of them have their origins in wild animals. So as we continue to destroy their natural habitats, we increase the probability of contact between humans and these wild animals, and the possibility of zoonotic disease jumping from the animal world to the human world. And we've seen increase in the frequency and intensity of these diseases in recent years, especially in sub-Saharan Africa. So these are environmental issues that have direct or indirect impacts on human health, and for humanity to effectively ensure that we have sustainable health and we live well on the planet which God has given unto us. We have to take good care of our environment and understand clearly that man cannot live in isolation of his environment. And the success and the health of man in this world is directly related to how we take care of our neighbors. And who are our neighbors? The animals, the plants, and the environment which God has given all of us to share. And that is why for us to effectively address this determinants, ecological determinants of health, it is very important for us to understand the concept of One Health. And the concept of One Health is a solution, I think, that can effectively address these emerging challenges and emerging health issues that is facing humanity today. It is becoming clear that the emerging challenges and the emerging health issues we are having as humans, whether at the national, global, or regional level, the source is not just from humanity. We have increase in emerging infectious diseases that have their sources from animal source or from environmental sources. And for us to effectively address human health today, we have to look at health holistically and not just consider human health, but we have to effectively consider animal health, plant health, and the health of our environment, which God has given to us. And that is why the concept of One Health is very important in our world today. And what is One Health? One Health has to do with the principle of understanding that man cannot live in isolation of his environment. And the health of man is directly related to the health of the environment he lives in, the food he eats, the water he drinks, and the air he breathes in from the environment. And for a human being to enjoy long life, prosperity, and sound health, he has to begin to respect his environment and take health holistically, putting into consideration the health of his environment. What the environment man lives in is healthy, man itself cannot enjoy health in this world. And that is why the concept of One Health is what we're preaching in our world today, to address emerging health challenges that is facing man in the 21st century. So One Health is dedicated to improving the lives of all species, human, animals, through the integration of human medicine, veterinary medicine, and environmental science. Understand is a collaborative effort of multiple disciplines, working locally, nationally, and globally to attain optimal health for people, animal, and environment. Together of different disciplines, transdisciplinary approach to address the health of human on health, taking into consideration the health of animal, plants, and the environmental health, bringing everything under one umbrella to accommodate total health, and so that human being can enjoy not just health of humanity, but the whole part we live in and the environment we live in should start working towards the health of the environment and the planet which God has given us to live in. And that is why the concept of One Health is very important. One Health, like we said, takes into consideration human, plant, and animal health, and it recognizes the interconnectivity between man, animal, plants, and the shared environment which God has given us. So for us to effectively enjoy the planet which God has given us for total health for humanity, and for us to reduce drastically these emerging infectious diseases that we have been increase in frequency and intensity, like Ebola, like COVID, like monkeypox, like Lassa fever, like HIV. Everybody knows what is coming next. The only approach that can effectively reduce and address these emerging challenges is the One Health approach. Human beings respecting animals and plants and the environment God has given us, living their habitat and letting them, allowing them to live peacefully in their own world. This is the interconnectivity and the complex transdisciplinary approach that can effectively address these emerging health challenges that is facing us in our world today. Finally, before I go, let me talk a bit about my organization. My organization is Global Emerging Pathogens Treatment Consortium, GET. So it was started by experts in different countries in Africa about 9 years ago, during the peak of the Ebola crisis that ravaged a lot of countries in Africa. And the MD of organizers of the webinar today was one of the founding fathers founding members of GET, because she's a woman. GET, understanding clearly during the Ebola crisis that African countries lack the capacity to cope with such level of biosecurity threats or health threats. African experts from different disciplines came together and formed this organization called GET. And our goals have been very clear in the last 9 years. We've been working with various government and non-governmental organizations to build their capacity to cope with emerging health challenges and biosecurity threats, using the One Health approach, the link between human health, animal health, plant health, and the health of our environment. We have different platforms and different forms of activities we conduct to achieve our goals and objectives. We publish papers. We have various publications from journals to policy briefs and newsletter that we publish. We do policy advocacy. We do outreach and community engagement. We organize one of the biggest biosecurity-based annual conference in the world. We conduct logistics during outbreaks and epidemics. We do a whole lot of capacity building, and we conduct different research on related topics as regards to biosecurity, climate change, and One Health. I'm using this opportunity to invite you to the night conference on One Health and biosecurity. This is a conference we organize every year, and the night one will be coming up later this year from the 1st to 3rd of November, Civic Center, Victoria Land, Lagos. Let me conclude with these statements. Nothing in nature lives for itself. Rivers their own water, trees don't eat their own fruits, and the sun doesn't shine for itself. Living for each other is the rule of nature. Please live and let others live. Thank you very much for listening to me, and I look forward to more conversations during the question and answer section. Thank you very much.
Okay, thank you very much, Dr. Dotun. Please, can we give a virtual clap to Dr. Dotun for his presentation? Yes, thank you very much. Yes, your presentation made us to understand that the three major determinants of life that our life depends on is water, oxygen, and food. And everything we've seen, that all this has been affected by climate change. And then if we do not take action, we don't know what's going to happen next. But we know that, yes, climate change is a public health crisis. And there is no vaccine that can address the problem of climate change. And the only way forward is for every person, individual, to take action. And you proposed One Health, which is the best solution to living a healthy life in the face of changing climate. Thank you very much, Dr. Dotun. We really appreciate your presentation. And then please, I would like to all the participants to please note your question. We'll get to the point of question and answers. For now, we are taking the presentation at first. And then I've seen people making contributions. Thank you. I will take note of all that when we get to that session. And then there is a link in the chat box. Can you click the link to register your participation? So on this note, we move to the next presentation. So please permit me to share my screen so I can give us an introduction of the next speaker. Yes. We have the next one, which is the impact of climate change on healthcare issues and challenges. So the person that will make this presentation is Oluwaseun Lawal.
Hello, Titi. Can you go on to read pending the time the thing shows up? Please, time is fast spent.
Yes. I'm trying to get a profile on the screen.
Please start reading it if you still can't get it. At least once you get to the page, people can see it. Yeah.
Yes. Yes, Oluwaseun Lawal is an health consultant and a researcher. She is a thoroughbred microbiologist from the Federal University of Technology, Akure, a creative health writer, a copywriter, health consultant, and accountability partner. She is strong-willed, purpose-driven, women's health enthusiast who promotes a healthy lifestyle and ensures people in general and women in particular live a life of purpose. As a freelance writer, she has written for Youth Hub Global, a women's forum, the International Human Rights Commission UK, and ghostwritten for other individuals on their health blogs. She is a passionate humanitarian who strives to give back to society and derives joy from doing so. This underscores her zeal for volunteering and collaboration. She has volunteered in community healthcare awareness, participated in polio immunization, and written articles on topical health issues. She volunteered for the International Human Rights Commission, IHRS UK, and the World Humanitarian Organization for Peace and Equity. As a volunteer, she visited and presented Christmas packages to an Ondo State Children's Home and orphanage managed by the Ondo State government, and visited a school during the International World Education Day, respectively. She has gradually built a team of 10 in Ondo State. She has over 7 years of work experience in Telnet International School as a sales representative, logistic manager, administrative manager, and bosser. Apart from writing, she's a good singer and avid reader, and she makes time to read and watch political and science-related issues on print and electronic media. Please, audience, please join me to welcome Oluwaseun Lawal as she make a presentation on the impact of climate change on healthcare, the issues and challenges. Please welcome.
Good afternoon. Hello.
Good afternoon.
Good afternoon.
Good afternoon, everyone. Can I go ahead?
Please go ahead and share your screen, please. I'll give you the right to share your screen.
Should I hold on for you to share the screen or?
No, please just go ahead and share your screen.
I won't be able to share. I'm using my mobile phone.
Okay, that's
and I'm
fine.
not
We'll share the screen. We'll share the screen on your behalf. Just give me a moment. Just go ahead. Yes, you can go ahead.
All right. Thank you. Thank you so much. Good afternoon, everyone. Thanks for watching. Thanks for this webinar. And happy World Health Day to all of us. So today I'll be speaking on impact of healthcare, impact of climate change on healthcare, challenges and issues. And I want to appreciate the opportunity given by me by Center for 21st Century Issues to make this presentation today. Thank you so much. I'm honored. So what is health? We all know about health, we all hear about health. So what is health per se? Health is a state of complete physical, mental, and social well-being, and not merely the absence of diseases or infirmity. So for the fact that maybe you are whole, you don't have a headache, you are not sick, doesn't mean that you are completely healthy. So health has to do with this complete state of your physical well-being, your mental well-being, and your social well-being. When these three are balanced, then you can say you are healthy. Health all over the world is affected by climate change. And that's why we are here today to discuss about climate change. What is climate change? Climate change refers to a long-term shift in temperatures and weather patterns. This shift may be natural, such as through variation in the solar cycle. We can see the way excessive heat, extreme weather, and all that. So it can be variation in temperatures and weather patterns. But since the 1800s, human activities have been the major driver of climate change, primarily due to the burning of fossil fuels like coal, oil, and gas. Evidently, climate change is the single biggest global health threat we are facing right now. It's a global health threat. And humanity and health professionals worldwide are very badly affected as well in this 21st century. What our health is and will be affected by the climate change through, number one, direct impacts. Through direct impact, our health is being affected by the means of heat waves. Heat waves like the excessive heat, temperature, the way the weather has been so hot, droughts. When everything is dry, definitely our water system will be affected. There will be poor water supply, poor water availability, and many others. Then heavy storms. When there are heavy storms, you know, our infrastructures, our community, many other things will be affected, and sea level rise. Then number two, we have indirect impact of climate change on our health. And this indirect impact includes vector-borne. Are you all with me? Can you all hear me? Should I go ahead?
I can hear you. I can hear you. Go ahead.
We can hear you.
Thank you so much. So the second is the indirect impact of climate change on us, and it's through our vector-borne diseases, vector-borne and airways diseases, which includes malaria, diarrhea, cholera, and many other things. Then food and water insecurity, undernutrition, and forced displacement. These are the two major ways that climate change is affecting us directly and indirectly. Statistically, an estimated 400,000 people die each year due to hunger, malaria, diarrhea, heat stress, and other diseases related to climate change. That is indeed so bad. And by 2030, the death toll is still expected to rise to 700,000 per year and cost the global economy 2.5% of GDP annually. Can we see that statistics? It's scary. And that's why now we need to rise up and take the action now. The direct damage caused to health is estimated to be between 2 to 4 billion US dollars per year by 2030. So flowing from the above, like we mentioned, the statistics you have highlighted, climate change greatly affects healthcare. And what is healthcare? Because that is where I'm going now. We've talked about climate change, and I'm glad so you're just about climate and health. So it's health. Healthcare is the improvement of health via the prevention, diagnosis, treatment, amelioration, or cure of diseases, illness, injury, and other physical and mental impairments in people. Climate-related events impact human health in two ways. Like I said earlier, they can directly cause illness, climate change on human illness. When we have extreme weather, you know what it causes? Malaria, vector-borne disease. When we don't have access to good water, there will be diarrhea, there will be cholera, and the more these are happening, people will keep visiting the healthcare system. Often, the illness, there will be injury, there will be increase of mental of life. Climate affects population and disrupts living conditions via damage to critical infrastructures, access to care or public diseases services, and impact on economic extreme rises. And when the sea level rises, you know what it causes? It causes rain, and when it keeps raining, like the forecast weather we are hearing now that last year we had a lot of floods across the state in Nigeria. We heard that this year's flood, if care is not taken, it will be double of what we experienced last year. We pray God help us and we intervene early. So there'll be flood, there will be changes in infectious agents, specific points, diseases, outbreak of diseases, just name it. Then there'll be reduced water quality. There'll be reduced water quality, there'll be wildfires. There'll be poor air quality as well. There'll be poor air quality. These are the three major things that is causing all this. Extreme weather, sea level rise, then rising temperatures. Then when we go deeper into the healthcare system, which is the facility and health risk, we have the infrastructure damage. This is as a result of all this you've mentioned. When the impacts of climate change result in these three, and it affected us in these different levels: poor air quality, flooding, changes in infectious agents, reduced water quality, wildfires, drought, and extreme heat. Definitely, healthcare system, there'll be infrastructure damage, there'll be energy system impact. We know that, like it's common in Nigeria here, once it rained heavily for days, it will definitely interrupt our power supplies, and we can go on for days without having electricity. Now imagine in a system, in a healthcare system, maybe something like a surgery is going on at that moment, and there will be disruption in power supply, and as well as some other issues, technical issues going on in the system. Definitely, it will affect the patient care. It will have an impact on the patient care. Yes, the energy system will be affected, and supply chain interruption. It is hard for you to go to a place to another place to deliver the equipment and all that things needed will be disrupted just because of the impacted. So these are all these effects of climate.
Yes, sorry. Please kindly unmute your mic. I think your mic is muted. Please unmute your mic.
Oh, sorry. I thought, oh, okay. So can we, I just explained the first diagram. I said that majorly, the primary impacts of climate change hazard is as a result of these three. When there's climate change hazard, there'll be rising temperatures, extreme weather, then sea level rises. When the temperatures rises above normal, the weather will be extreme on us. It will be so hot. Then at later end, it will cause a sea level rise. And when these three affected the impact, that's the primary impact of climate change, it go deeper into and more impacts like flooding, changes in infectious agents, reduced water quality, wildfires, droughts, extreme heat, and poor air quality. Those are the other impacts on individual, on us now as individual, as on our health. Then when we now look at the health facility, healthcare system now, the deeper impact of climate change is infrastructure damage. Like we can see where there are flood, where there are storm, definitely the infrastructure will be disrupted, will be damaged. The energy system will be affected. There will be supply chain interruptions because if there are a lot of extreme weather abnormality, a situation where you are supposed to take a product or some kind of medical aids, tools to another facility, it might take longer time for you to get there. So there'll be supply chain interruptions, there'll be health services disruptions, and patient care impacts. So these are all the impact of climate change, the primary impact of climate change on us, and even on the healthcare, on our healthcare system. This diagram explains that. Then when we go to the next diagram below, it's also explained them in words, and it's simply divided them into three. How climate change affects human health, majorly by direct impacts, indirect impact through natural systems, then indirect impact through social economic systems. In direct impact, like I have said earlier, it causes injuries, disease, and death due to extreme weather events, increased frequency and intensity of heat waves, excess heat-related mortality, and incidence of heat exhaustion. Then aggravated circulatory, cardiovascular, respiratory, and kidney diseases. The third one is indigenous and traditional peoples are also expected to suffer the most because in their locality, like last year, we see the way flood happened all over, especially some areas in Nigeria, Kogi State and all that. We can see the impact on people. We can see the impact on those villages. So indigenous and traditional people are also expected to suffer the most. Then we have health losses caused by disasters, such as storms, hurricanes, tornadoes, and floods. All these are direct impacts of climate change on human health. Then when we go to the second group, indirect impacts, these are through natural systems. We have airway diseases and allergens. Diseases such as asthma and allergic respiratory diseases are exacerbated by exposure to aerologens. When the weather is extreme, when there are poor air quality, people easily are attacked, especially the asthmatic patients, and there are even more increase of such. Then we have increased cardiopulmonary mortality due to high particulate matter an atmosphere level of highly toxic ozone. You know, when the ozone, when we keep inhaling, like, thank God for improvement that is going on, unlike before. Before you move from a 5-minute distance, you will see someone powering generator, you know, generator here, generator there, and all that. The more the generator are around everywhere, the more they release a particular gas, carbon monoxide, and there's no how we won't inhale it. So the more we keep inhaling all these things, it's definitely going to affect human health. And that's just one of the examples: cardiopulmonary mortality due to high particulate matter and atmosphere level of highly toxic ozone. Then we have food and waterborne disease. It is projected an increase of an 8 to 11% in the risk of diarrhea in the tropics and subtropics by 2039. Then we have accelerated microbial growth, survival, persistence, and transmission of pathogens. That's why we can see more and more of antibiotic resistance these days. So you have to combine drugs, even the so-called malaria drugs, we need to combine them before it can be effective on us, because these are all the effects of climate change that is happening. Shifting geographic and seasonal distribution. Example, we have cholera, schistosomiasis, and harmful algae blooms. Then we have vector-borne diseases. A warmer climate will increase the reproduction rate, resilience, and distribution of vector-borne diseases. For like malaria, recent estimate project that the additional number of people at risk of infection due to year-round transmission in South America will rise from 25 million by year 2020 to 50 million by 2080. Wow. So that is the indirect impact through natural system. Then the third group is indirect impact through socio-economic systems. And that one is food and water insecurity and undernutrition. Increased risk of undernutrition resulting from lower food production, especially in the tropics, and food access. We have combined effects of undernutrition and infectious diseases, chronic effect of stunting and wasting in children. Then we have occupational health and vulnerable populations, risk of heat exhaustion, cardiac arrest, and more frequent work accidents for outdoor and unprotected workers. Loss of work capacity and reduced labor productivity are also expected. The elders, the children, and people living in poor environments and indigenous and traditional populations are expected to suffer the most. Then we have, lastly, forced displacement, mental illness, and stress. Increase of stress on all those who are already mentally ill creates sufficient stress for some who are not yet ill to become so, such as severe anxiety reactions, depression, aggression, and complex psychopathology, sense of loss. Heavy impact of climate change on human health. Moving forward, climate will continue to affect the 4 major determinants of the health. When we talk about health, we should look into these 4 major determinants. And unfortunately, climate change is affecting them. We have clean air, safe drinking water. When we inhale clean air, it helps our system, it helps our lungs. There's normal digestive, normal breathing system, going on in our body. So we should look at these 4 major determinants: clean air, safe drinking water, sufficient food and secure shelter. Sufficient food and secure shelter. These are 4 determinants of health. And all these 4 is what climate change is having adverse effects on. So these are the 4 areas we should be looking on and should look for ways of preventing or reducing climate change on them. One can infer that the healthcare professionals in the vanguard of healthcare delivery are experiencing the physical and mental health risk of climate change than the general population. It not only disrupts their lives, but also makes their jobs more challenging. Many of them will spend more hours. Many of them, before they will get to their location due to climate change impact, most times it takes them a lot of distance, like suddenly there are every rainfall, and all the roads are blocked. For them to get work daily is another work on its own. Getting to work, meeting a lot of patients, attending to a lot of patients is another challenge on its own. So healthcare professionals are heavily impacted by climate change. Storms, floods, wildfires, and other extreme events often prevent them from traveling to healthcare facilities. As more people get sick because of climate change, there will be a greater need for a larger climate-ready workforce. The health sectors are not only affected by climate change, but they also contribute to its menace. Yes, it's what they are bringing into the air that is giving them back. Health sector to contribute to climate change through a burning of maybe power gen, what they do continuously, the way they burn refuse around and all that. So they are putting it back into the society. Globally, the healthcare sector emits 4.4% of global greenhouse gas emissions. So we can see that they also are putting back to the climate, and that's why the climate change too is giving back, is even multiplying it. What they are putting 4.4, it will multiply it in numerous, and in another arithmetic, and bring it back to the head, bring it back to us. So the health sector has an important role to play in managing the deleterious effect of climate change occasioned by human and natural occurrences. Investment in green healthcare facilities must be made. And examples of these green healthcare facilities is use of solar panels, energy efficient equipment, and proper waste management. We should think about that. Investment in greening healthcare facilities must be made. Globally, only about 0.5% of multilateral climate finance has been attributed to health projects. That is insignificant, because we in the healthcare, they need more finance, they need more fund. To get solar panels, they need money, they need more funds. So we need to look into that, to how the government, how the society can finance our healthcare and health projects. Healthcare facilities need to be safe and operational sustainably. In the Americas, 67% of health facilities are located in areas at risk of disasters. Notwithstanding, 24 million people were left without access to health care for months because of damaged infrastructure in the last decade. Reducing emissions of greenhouse gases through better transport. Now, this including the way forward, reducing emission of greenhouse gases through better transport, food and energy use choices can result in improved health, particularly through reduced air pollution. It is vital for the healthcare workforce to be trained in identifying and addressing health risk associated with climate change. This is now time that we need to make more awareness and train our workforce. Let them be aware about what they are putting into the climate, the impact of their own usage of climate too, what they do, their activities, so that they would be able to reduce the climate change effect. So it is vital for healthcare workforce to be trained in identifying and addressing health risk associated with climate change. In the event of health system disruption, the workforce should quickly adapt to delivering care. The above, among others, will adequately and sustainably reduce the menacing effect of climate change on the healthcare system and workers in particular, and generality of the public. Thank you all for listening. So I would be expecting more questions, contributions, and more solutions to help ourselves to make this climate change friendly to us. Thank you.
Okay, thank you very much, Mrs. Oluwaseun Lawal. Dear audience, kindly join me to give a virtual clap to Mrs. Oluwaseun Lawal for our beautiful presentation. Please, so thank you very much. It is clear the science is there. We all know that the crisis and the impact of climate change, it has devastating effect on all parts of our lives, and healthcare is not an exception. So we've seen the two speakers before now, they've made us understand the impact, and we've seen the sciences behind the problems of climate change and what we need to do as an individual to address the issue. So we've talked about it. Now we are looking at, now we're moving on to creating a pathway to ensuring the health system is resilient, and that we have a fantastic health systems in the face of the changing climate. So this will take us to the next presentation, and that we have Dr. Adefolarin Opawoye. He will be explaining to us the pathway to climate resilient health systems in Nigeria. So we've seen the problem. We know, yes, the problem is there. So what are we going to do to create a resilient health system in Nigeria to have a good health for all of us? So Dr. Adefolarin Opawoye, MBBS, FWCACP, infectious diseases consultant at Lagos State University Teaching Hospital, and is the PRO Nigerian Infectious Diseases Society. Adefolarin Opawoye is a medical doctor, a consultant in infectious diseases at the Lagos University Teaching Hospital. He's also the public relations officer of the Nigerian Infectious Diseases Society. He has been a part of the nation's emergency response in outbreaks such as Ebola, Lassa fever, monkeypox, and then COVID-19. He's also interested in infection prevention and control, having helped set up isolation centers and trained thousands of workers from every sphere of life on how to protect themselves and others from deadly diseases. He's an avid speaker, a compere in his spare time, and loves to read books. He's married to Oloruntobi, a lawyer, and they are blessed with 3 children. Please, audience, join me to welcome Dr. Adefolarin Opawoye as he speaks on the pathway to climate resilient health system in Nigeria. Dr. Opawoye, you are welcome.
Thank you very much. Good afternoon, everyone. It's really been lovely listening to all the wonderful speakers that have gone on ahead. I actually was preparing for like 1:35 based on the schedule. I didn't know I would come up earlier. So just give me about 3 minutes to start, and I'll be with you shortly. So I'm going to ask the admin, I'm going to ask that they allow me to please share my screen. Thank you very much.
Okay, so you have the right to share your screen. Please go ahead, sir.
Yeah, no, just a minute. Not
yes.
This screen. I'm logging in on another device.
Okay, it's fine.
Just
it's
a
fine.
minute.
All right. Okay.
Yeah,
yes, I just want to remind us all that you can please drop your questions in the chat box, and there is a link that has been dropped in the chat box for you to register your participation. And then please keep the questions coming. After Dr. Adefolarin's presentation, we'll go straight to the questions and answers, and then take your contributions. So please, if you join the meeting, kindly mute your mic because that is affecting the others. Please, when you come in, please mute your mic, and please take note, if your mic is unmuted, you can always mute it at every point. Yes, thank you, everyone.
Okay, sorry. Thank you very much. Can you just allow Olorun to be a part?
She can share screen. Anybody can share screen. Please, she should go ahead and share.
Okay. I'm trying to open it. Yeah, okay, so sorry. To shortly. Thank you very much. So sorry. Can you all see my screen, please?
Yes, we can.
Yeah.
Okay, thank you very much. So I'm so sorry. I was getting ready for another 10-15 minutes. I didn't know we were going to be so prompt with the time. Thank you very much. Okay, good. So I doff my hat to all the wonderful speakers who have gone ahead and speaking about this very, very important topic of climate change. Thank you so much, 21st Century, for organizing this very germane discussion. And quickly now, I'm just trying to build on what other people have said by giving a summary and also just moving on to, most importantly, profiling the solutions. Once again, my name is Polario Power, and thank you so much for being here. Just a minute, let me. Good. Thank you. Yes. So, I hope you can all see my screen. So this is Otuoke in Bayelsa State. And for those of us who are familiar with politics in Nigeria, this is actually the hometown of our president before the last administration. This is President Goodluck Jonathan's hometown. And you can see the outreach from FMC Bayelsa. Of course, this picture was taken during the flooding in November 2022. This is what we are talking about. This is the reality of climate change. Obviously, of course, nobody can assess care here. You have to wonder about the integrity of the instruments and equipment here and the damage that has been done. And all these things have been highlighted by the wonderful people who have spoken for me. So I am not going to be going back over that, but they just bring it home as to the problems that we are talking about. This is my outline for this discussion. I will talk about the definitions, historical background, the challenges, the impact, and most importantly, the strategies or the pathway to creating a climate-resistant environment. So we've talked about all this. I wouldn't go back to just definition of the healthcare system, and just to note that it's all encompassing, including the primary, secondary, and the tertiary systems. Okay, so it's very important to note that. And climate change, we've talked about that again. We have to know that it has far-reaching effects, burning of fossil fuels, deforestation. All those things are things that we can do. Now, the challenge generally with climate change is that the effect is not apparent. Okay, it's not something that you cut down it today and you see the problem immediately. It's over time. And that is why if we are not calling ourselves to these issues, we are not going to do anything about it until it is too late. And that's, once again, I'm grateful for this opportunity to talk about this. Yeah. So we've talked about all this, the long-term changes in weather patterns, and it has far-reaching effects. Okay. So it's important to look at the healthcare system in the context of climate change, because those two things impact themselves. And it's important for policymakers and healthcare professionals to develop effective strategies. And once you understand the problem, it's half of the problem is solved. The whole idea is to be able to do something about it before it is too late. And that's what we're about to discuss here. Looking at healthcare in this country, of course, we all started from traditional medicine. Unfortunately, some people have still not left traditional medicine, but that's where we started from before the Europeans came and they introduced Western medicine. These are the traditional people, my Akakwe community all over the place. I hope there are not people on this call that still use them. I know there may be, but we know that some of these things can be quite dangerous. You know, in fact, sometimes even the color, you know, you see green and red and blue together. Well, it's not as if you are taking Chapman, you know, but that is the reality of some of our people. Okay. And now over the years, government has taken on a major role in taking care of the health by things like the National Primary Healthcare Development Agency, the National Health Insurance Scheme, and all that are things that the government has done. So our healthcare is a mixed system. We have the public, we have the private sector. Public healthcare, of course, was through the government with the primary, secondary, and tertiary healthcare. Primary healthcare is usually at the community level with the healthcare PHCs, the primary healthcare centers, and community health workers. The secondary and tertiary healthcare are the general hospitals, the state hospitals, specialized centers like the orthopedic hospitals, the teaching hospitals, both federal and state. And the private healthcare is a significant provider of healthcare services. And we have to remember that most people go to the private healthcare first before they go to public. And a lot of times when they are making these kind of plans in government, we do not involve the private health sector in our thought processes. But the private health sector is very, very crucial, and they play a significant role in the healthcare delivery in the country. So whatever we are doing, we have to involve them, because most people, including most of the people on this call, will actually go to the private hospitals before they go to the government. So it's very important for us to put them in our solutions. Of course, there are so many problems we've talked about. One of the major ones is the shortage of healthcare workers, the brain drain, the jackpot phenomenon. Every day, people keep asking some of us, what are you still doing here? And people are going all the way to Saudi, Qatar, US, UK, Australia, everywhere. So it's been a big, big problem. Just yesterday, there was a bill that was proposed by the House of Reps as to making sure doctors work for 5 years before they are allowed to travel out of the country. And you can imagine, of course, there's a lot of indignation over that you can't tie people down. But it just tells you that there's a problem and the government is confused as to what to do about it. Of course, we have issues with underfunding, with inadequate infrastructure, equipment, and staffing levels, most especially in the rural areas. The problems of our healthcare system are well documented: long wait times, limited access to care, poor quality of care, lack of coordination. Okay, very, very important. Everybody's working in silos, and we don't even have the data to guide our decision making. There's a lack of adequate health information systems. The impact of climate change has been stressed by the various speakers, so I would not really waste too much time talking about it. But these things are real, okay? And we have to note that. The challenge again, like I said earlier, is that we don't see the problems immediately, so we don't take note of it. We just think, oh, maybe the rains are just a bit more. Oh, maybe the rains are just a bit less. But these things become cumulative over time. And for those of us in the urban areas, it doesn't really affect us directly. Like Mrs. Sean was talking about, these are problems that are felt more in the rural areas. I don't deal with rain as much as the farmer deals with rain. For the farmer, the rain coming at a particular time can make the difference between having a bumper harvest and having zero. Okay, the rains coming early or coming late can be very, very significant. If it is more than the one of the last year, it can wash everything away. If it is less, it can lead to drought. So for them, it's very, very important. And we have to note that if we don't get the food from these farms, we also will be in trouble, even those of us in the urban sectors. Okay, we've talked about the indirect impacts, damage to the healthcare facilities, all these things that we're talking about. Okay, so you can see here, this is a road. This is also taken from the Bayelsa flooding of last year. And we can see that there are no cars that are using this place. We are using canoes from house to house. The whole east-west road was actually cut off. And even flights could not land. Okay, so you can imagine the entire community was isolated from the rest of the country. And it led to all sorts of fuel scarcity, food scarcity, everything, because they couldn't bring products in. The products that were in, they couldn't take them out to that were living in those places, and those are the realities that okay, we've talked about all this spread of vector. It's important for us to note that. Okay, food and water security again. I talked about. I will not waste time speaking about that. And now to the crux of my talk, which is on the strategies, on the pathway. How do we mitigate these problems? It's important for us to improve disease surveillance and response. This is very critical in identifying responding to disease outbreaks in a timely manner. So the reality is that climate change is inevitable. What we try to do is to reduce the rate of change and slow it down over time. So when these diseases come, it is important for us to be able to identify them early and respond to them. And that can be done by improving laboratory capacity, enhance disease reporting systems, strengthen public health emergency preparedness and response. The good thing is that Nigeria has made progress in this area, particularly in response to the COVID-19 pandemic. Unfortunately, most of the gains we made during the COVID-19 pandemic has been lost. Most of the labs that were open there, they were open for commercial purposes. Once the traffic died down, they have stopped working. So I'm a bit worried that if we have something similar to COVID in Lagos today, or even in the country, Nigeria, we may actually be a bit backward compared to where we're coming from. And this is why it is important to have continuity. We have issues with continuity in this country. A lot of the things we do are just short-term projects. Everybody wants to make a name for themselves. So we don't build systems. Okay, and that's why I'm happy with the topic. It's talking about a system. Okay, you can just do your own. Say, oh, my own hospital is very good. We attend to patients within 5 minutes. But what happens if the hospital 30 minutes away from you? What happens in the rural areas? I remember when I went to serve in Delta State there, I was everything. I was a consultant gynecologist, neurosurgeon, physician, laboratory side, everything. And I mean, for somebody who was fresh out of medical school, of course, a lot of patients died, and there was nothing I could do about it, So it's very, very important for us to take a systems approach as a solution to these problems. Okay, one of the things we need to do, again, talking about solutions, is creating awareness on the impact of climate change on health. And this is part of the things that we are doing now with this public talk, with this lecture on World Earth Day, to say, this thing is a problem. That tree that you are cutting down is going to be a problem down the years. That bush that you are burning, a lot of times in the village, you must burn bush all the time. You need to create awareness. And there needs to be, you need to ensure community participation. Preventing climate change is not the work of one person. Everybody has to agree. Okay, we are going to plant trees. Is everybody that will do it? Because if you do a program, even if you do a program, bring a lot of money, plant those trees and walk away, you can be surprised that in the next 2 years when you come back, all the trees are dead, or maybe goats are eating them. So it's very, very important to get the buy-in of the community. You have to go down to the grassroots and let them know that, look, these things that you are doing affects everybody. I don't know if you have seen the situation where you go to the market and the market woman will sweep the front of our shop and sweep everything that is inside into the gutter. So long as it's not in front of our shop, it is not disturbing her, but she will sweep it into the other shop. All these are things that we have to let people know that we are not living for ourselves. If these things falls for this person, it falls for everybody. Community has to be guided in the use of adaptation processes. All the things we are talking about burning of biomass fuels. burning of firewood, deforestation, where they go and cut trees for this firewood. Okay. Now you can't tell the people in the community that they should stop using firewood, and you don't give them alternative. So how are they going to cook? That is not sustainable. So whenever we are doing this, and that is what makes a lot of these measures to fail, because they are telling me that I should not use firewood. I use firewood to cook. I have used firewood to cook before one time in my life. I used to cut firewood and axe and everything. You know, at the time when kerosene was very expensive, that was in the early 90s, back in the village. But if you are telling me don't use firewood to cook, there's climate change, you kill the earth, you kill the society. But then I tell you that I will die if I don't eat. So what are the options? So we have to provide viable options. We are telling them not to use firewood. Are you bringing gas? Are you bringing biogas for them? Are you bringing methane gas for them? What are you giving them? So all these things are very, very important. Okay, there must be political will for sustained programs and multi-sectoral collaboration. Like I've said, we love working in silos in this country. Ministry of Environment to just do their own. But we have done projects. Ministry of Health is not involved. Ministry of Water Resources is not involved. Ministry of Labor is not involved. Internal Affairs is not involved. They're just doing their own thing. That, oh, we have done our own, and then you leave, and then all the problems are still there. Okay, so there has to be sustainability of the programs. Climate change is not something you alter in 1 year, in 2 years. It's something that is long term. If you plant a tree today, before that tree starts contributing to reducing the impact of climate change, it might take another 10, 15 years before you can stop deforestation and all that. But our people will do their own. So this is the work of this administration, and then they are gone. And we, the populace, are also not helping. They are asking, oh, so you that you have been in government, what have you done? You are just continuing the work of another person. You have not done your own, which is not true. We love the short term, and those are some of the major issues that we have. It's also important to have what we call a top-down approach. One of the biggest challenges with climate change is that most of the ardent proponents of climate change are seen as hypocrites. So this, for example, was a title taken from the Guardian UK, where they were doing a conference last year on climate change. It's called the Davos 2022 conference. And in that conference, most of you that went there actually went there with private jets. Like private jet, maybe you can take about 7 or 10 people. Okay. And the emissions from that private jet was equal to 350,000 cars. Okay. There are about 138 private jets. So it's all these things that reduce the impact of the message. When you are telling people with mouths that, okay, don't burn firewood, don't burn the bush, and then you now carry private jet to the conference. That private jet is like you are burning a whole 10 acres of land. It doesn't work like that. The people that are preaching this must start from the top. If you don't want me to burn fuel, okay, you don't want me to burn the bush, you don't want me to release smoke, then don't carry jets to you to go by rail, by train, okay, or go by ship or something that is equally fast and sustainable. All these things are very, very important solutions to solving these problems. It's important for us to upgrade our infrastructure and develop resilient infrastructure. Okay. Now you might ask me how possible it is. Well, we have countries like Japan that suffer from a lot of earthquakes, and these people have been able to develop buildings that are very resistant to earthquakes. Or if there is earthquake, when they fall, they don't injure and kill people. When you have an area that is susceptible to flooding, then when you are building, you have to build them on stilts. Okay, you have to make sure that you improve your drainages. You can look at gutters everywhere they are blocked. We don't have good gutter hygiene in this country. Most people just throw everything into the gutter and walk away. When you are doing that, you are not helping the infrastructure, and you are not helping the building. What are the kind of materials we use to build? We know that, for example, if you take interlocking tiles and use them to make a road, even if it's in a flooded area, the interlocking tiles, the concrete from interlocking tiles can easily absorb water. And so if there's a flood, they absorb the water and everything goes away, more than if you are using tar, okay, to do that particular road. So all these are things that we need to do to upgrade our infrastructure. Training of healthcare workers is very important. Well, I mean, maybe the first problem is that the healthcare workers have to be available to train. If you ask me, what is the solution to the brain drain? It's difficult, to be honest. And like I told you earlier in this lecture, the House of Rep, they are trying to propose that doctors must be forced to stay back for 5 years after they have graduated before they can leave the country. But how long is 5 years before it is complete? What happens after the 5 years? Okay. And then if you are stopping doctors, what of the nurses? What of the pharmacists? What of the laboratory technicians? Because all these people are also great. Okay. So it's a very conundrum without clear solutions. But it's important to retain the healthcare workers somehow, okay? Because it takes a long time to train a doctor. And once a doctor leaves, it's difficult to replace some of those skills. And when you are training, when you are making them accessible, you have to train them, okay, so that they can be able to provide care in climate sensitive contexts. So is there a flaw? We have to take a vote. I remember I was in Delta State in 2012. During the year, there was a flood there at that time too. Okay. How do we take care of these people when there's a flood? How do we go to the desert to take care of these people? All these things must be talked about. Investments in healthcare infrastructure and delivery system can also create jobs and support economic development. There's a lot of rules for getting access to rich areas, okay, during healthcare emergencies. All these things are things that we can invest in and can develop the system. It's important also to look at agricultural practices. Okay, agriculture is one of the major contributors to climate change, and it's important to have climate smart policies such as crop diversification, conservation agriculture, forestry, planting trees. Okay, can help farmers to adapt. Okay, we have to look at sustainable food production and distribution, because one of the major effects of climate change is food insecurity, which we've talked about that. And when we are looking at the way we are producing the food, we are looking at producing it in efficient ways that does not increase greenhouse gas emissions. Okay, all these things are very, very crucial. Research and development is another area. We have places where we can grow rice that can stay in flooded places under the water. It will still grow very well without any problem. There are crops that can grow in arid areas that are dry. Okay, they are strengthened to live and survive and thrive in those areas. All these are things that we have to do to look at plants, varieties that are tolerant to extreme weather conditions and to pests. And all this will improve food security and to help to reduce the impact of climate change on health. Okay, increasing access to clean water is very, very important. Most of us, even for those living in urban areas, for example, I live in Lagos, don't have water. The government, everybody has to build their own boreholes. And then I know for people living in some areas like Lekki, for example, they won't have nothing. I know someone in Lekki who has never had water in their house for more than 20 years. Okay, they always have to go and buy water. So all these are things that are not sustainable. If you're having those problems in the urban centers, then you have to wonder what's going on in rural areas. Water is basic. Okay, all these are things that we should have. Improving water supply systems is important. Promoting the use of water-saving technologies. How much water are we using to wash the car? Gallons of water are used to wash cars every day. How much water are we using to flush the toilet? Okay, all these are things that we have to we have to look at. Okay, you understand, and look at how we can conserve water and be able to recycle properly. Okay, investments in clean water and sanitation can have economic benefits because it reduces healthcare costs and increased productivity. All these are means by which we can improve our systems. So reducing greenhouse gas emissions, transitioning to renewable energy sources. Okay, do we have a system where we don't depend on oil? I know when we hear dependence on oil, because in Nigeria, oil is the most important driver of our economy. So we're even a bit worried that when the world says that they want to use oil again, but the reality is that if you have been to where they are mining oil, where they are drilling rather for oil, and where they are doing gas flaring and all that, you know that it's a very, very horrible process on the environment. So you have to look at more renewable sources. I will talk about windmills, like you can see in the picture. I will talk about solar power. Okay, all these things are more sustainable. And we have to promote energy efficiency and conservation. You know, there are those of us that we don't leave the AC on, even when we are not in the room. Just leave it on
for 24 hours. That is not helping the climate at all. Okay, emissions from the transportation sector and the industry. You see some cars, they are like, they are like bonfires. They're just passing on the road shouting, poo, 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 with also some smoke everywhere. Okay, all these things are things that we have to take off the road. Okay, and make sure the cars are properly serviced. I know to an extent the BIO deals with the private vehicles, but one of the major problems we have in the countries with the public vehicles that they just seem to be a bit unregulated. So when we work on all that, it will help us to reduce emissions. And Nigeria has made commitments to reducing greenhouse gas emissions under the Paris Agreement, but these things are expensive. Solar power, for anybody who has done inverters and solar power, it is very expensive. Sometimes even more expensive than paying for NEPA. But the reality is that that's the way forward, and we have to find a way to make these things work for us. So in conclusion, the Lancet, in a survey done in 2015, concluded that climate change is the biggest public health threat of the 21st century. But tackling it also can be the greatest global health opportunity. Important to note that the healthcare system in Nigeria is already under strain. Okay, we already have a lot of issues, especially from the brain drain phenomenon. We don't have doctors anymore. I can speak from experience as someone working in the hospital that it's getting really bad. And the impacts of climate change are going to exacerbate these challenges that we're already facing in the system. Addressing the impacts of climate change on health in Nigeria requires a multifaceted and integrated approach. Please, we cannot afford to work in silos. We cannot afford to work as individuals. Every hand needs to be on deck to be able to make this things work. Policies need to be made. Laws need to be enforced. Okay, it's not just about making the laws, but enforcing them and making sure that there are adequate penalties when these laws are breached. The reality also, I don't like to just be a doom sayer. It's important to note that Nigeria has made progress in addressing some of these challenges. However, there's a lot of work to be done. And investments in climate resilient infrastructure and health systems can create jobs, support development, improve the resilience of communities, and protect the health of the people of this country. The reality is that we all have a part to play in building better health systems. And to do this, we have to look at the influence of the government, the civil society, and the private sector. Everybody needs to work together. Okay, this is not just something we can dump on the laps of the government and not refuse to claim responsibility. Okay, we all have parts to play. Every individual has to work together to keep this heart livable for us. Elon Musk has gone to the moon now and is looking for how to get to Mars. We can't afford it. Okay, they are already looking at that as a means of civilization in case the heart starts to misbehave. But this is the only art that we have, and it's important for us to let it work for us as long as possible. For those people who watch the shows, you will be familiar with Superman, and we know what happened with Krypton when Krypton collapsed, and because the planets could not sustain life anymore. We hope that will not happen to Earth. We know it may not happen in our lifetimes, but which kind of heart are we leaving for our children? All these things are very important. We all have a role to play, and the work starts now. Thank you very much.
Thank you very much, Dr. Adefolari. Yes, we all have a role to play, and the time to act is now. Honestly, there is nothing to say more than that. Yes, that the time to act is now. And then, yes, we know people are doing their best to address climate change from community level to organization and to government. But we still need to keep on doing it to ensure that we will not rest until we see that climate change is no longer with us. So thank you very much. It was an interesting conversation, and giving us different strategies to make our health system in Nigeria resilient. And then I hope, and one of them is continuous awareness, because yes, we continue to tell people, we continue to create awareness on climate change and let people see the impact of climate change, even on our health system. So this has to be a continuous effort on the part of the civil society and on the part of the government, because only government cannot do it. Thank you once again, Dr. Opawoye. So this will take us to addressing some of the questions that has been dropped in the chat box. But before I read those questions, if you would like to make contributions or ask questions, I would like for you to raise your virtual hand. Then I can take three questions for a start before we go to the ones. But if we don't have that, then we'll go straight to the one in the chat box. Please, if you have a question, just kindly raise your virtual hand so I can give you the opportunity to speak. Please unmute your mic and speak on. I've seen you drop several questions and contributions in the chat box. Please go ahead.
Thank you very much for those wonderful presentation. I'm Frank Asimbo. I'm the founding chairperson of the Congolese Diaspora for Nelson Mandela Legacy, and I'm following the discussion, the presentation from South Africa. I think in terms of contribution, you know, the problem is very huge and scary at first sight, but as a contribution, I can say that the awareness campaigns is not enough alone. We should also educate. This is my contribution. Campaign, awareness campaign, and education. Thank you.
Thank you very much, Frank Asibo, for joining us from the French speaking African country. Thank you very much. So he said that we should do continuous education. It's not just awareness. Awareness only is not enough. We need to incorporate climate education into the school curriculum. So even we can start taking it from the elementary level up to the university level. Thank you very much. Is there another person who has something to contribute to that? Okay.
Titi, can we please go to the question that have been dropped in the chat box so that the speakers can respond? Yeah, Titi, please unmute yourself.
Yes, I'm sorry. I have been talking. Okay, I was reading the question in the chat box actually. I said, okay.
You didn't unmute yourself.
I didn't know about that. I'm sorry about it, please. I was, Mr. Frank Asibo. I said, thank you for joining us from the East Coast. And then it's nice to have you here. And then you said something about, yes, climate awareness is not enough for climate education, that it is important for us to incorporate climate education into the school curriculum from elementary level to higher institution of learning. So thank you very much. So there is a question here in the chat box, and this could be addressed by any one of the speakers. The question is, the first global stocktake encourages the regenerative agriculture. Could one of the presenters explain what it's all about properly, please?
Okay, good afternoon, ladies and gentlemen. Let me attempt to answer that or to speak to that question. Yeah, regenerative agriculture is from the word itself. Regenerates, it means to something like improve or enhance or rebuild. That is the meaning of to regenerate. So when we talk about regenerative agriculture, we're talking about systems and an holistic approach to agriculture that improves soil quality, that improves output from agriculture without, that also take into cognizance the local farmers that produce, that are into agricultural production, without necessarily concentrating on financial gain or outputs alone. So it's an holistic approach to agriculture, not just plant agriculture, but plant animal agriculture that has to do with the soil, that takes into cognizance the health of the soil, which you're planting, and make sure that your agricultural process does not destroy the soil. It encourages climate change mitigation. That means it doesn't release greenhouse gases, especially carbon, just anyhow. And it takes into consideration your ways of production, planting of cover crops, introduction of compost and manure into the soil to regenerate the soil. Take into cognizance those that are producing your work, your workers, and those that are directly involved in day-to-day agricultural activities. So it's a whole lot of climate smart agriculture that has to do with understanding the process of agriculture from the beginning to the end, and making sure that you take into consideration the ecology, the social aspects, and as you also consider the financial aspects. I think that's just a little summary of what I understand by regenerative agriculture.
Thank you very much. Thank you very much, Dr. Doctor. So somebody asked another question, that can we advocate for communities to develop adaptation and mitigation strategies to address climate change? So I would like to invite Dr. Opawoye to please answer that question.
Thank you very much. That's a great question, and yes, it's one of those things we do in climate change to encourage people to adapt, and like it's been said, it really starts from an education kind of a thing. These are things that we have to build into curriculum all the way from primary school, secondary school, the university, the formal and informal education, so that everybody can understand the importance. Because if it's not easy, it's difficult. Many of those things are more expensive than what we know. Okay, so it's just like you're telling someone who uses a diesel generator or a petrol gen that, oh, look, solar is better. Yeah, we know it's better. We know it's cleaner. But what of the money? It's also it's also important. If you don't give me the money, then don't come and disturb me. And we know one of the presidential candidates in the build up to the election talking about the whole church rat proverb, about the importance that you can't tell the church rats to avoid a poisoned food if that's the only food that's available to him, and which is very, very true. So yes, the community can be encouraged to adopt these mitigation and adaptation strategies. However, it is more important to provide them the means. So you start from providing them the education to let them know that these things are important. Then you give them some kind of incentive, okay? Because these things are not easy. We have to be true to ourselves that some of these measures are expensive. Okay, if you're telling people that, oh, we want to use green energy, let's not drive cars, let's be riding bicycle. At least you give them bicycle first. Train them to ride it. Give them means, yes. Because it's easy to say these things with mouth. And at the end of the day, it's not going to work. You understand? So we have to provide them the means and the ability to do these things so that it is easier. Otherwise, all these things will just die. Thank you very much.
Okay, thank you very much, Dr. Opawoye. Yes, and this question is specifically for Mrs. Oluwaseun Lawal. What are the major health impacts of climate extremes?
The major health impact of climate extremes is definitely death, illnesses, diseases. Like we like one of the statistics I read earlier that by 2030, the death toll is expected to rise to 700,000 per year. So we can see that major climate change. If we don't start working on it now, the major impact will be death, outbreak of diseases. We've heard about coronavirus, many other viruses. God forbid, we don't know what virus is coming next. So those are the major climate impact of health, climate change.
Okay, thank you very much. There is this last question in the group. It's saying that in Bonn, Germany, there will be the Ocean and Climate Change Conference, and then they will still wonder how the policymakers are going to strike the balance between the ocean's protection and livelihoods of those countries that rely on oceans for survival. And at the same time, what are the laws and provisions for NGOs to play decisive role to change things for the better?
Yeah.
Yes, please, anyone can take this actually, because it's not, the question is not directed to anyone, but one of the speakers can take it. If you would like to take it, we would love to have you. Hello?
Okay, well, yes, sorry, this is for again. Well, the challenge generally is that with climate change is doing a balancing act. You can't be saving the environment at the expense of the people living in the environment. Okay, so it's very, very important to keep balancing that. And that's the whole issue about what is the conference that is going to happen in Germany, to be able to balance the needs. It's a risk-benefit thing, a scale of preference. What can we protect? How can we protect it while also safeguarding the lives of people? One of the biggest arguments against the climate change community, I mean, there are a lot of scientists that don't believe in climate change. I wouldn't say I'm one of them. I know these things are real. I feel angry when people are cutting trees. Okay, I take it personal. You understand? But also, you have to agree that some of the climate change proponents have also taken it to the extreme. And that balance is what we need to do to be able to forge a way forward, to say that, okay, guys, we are disturbing the heart. We are overdoing things. So, for example, last week there was a great condemnation from Jordan Peterson, who is a Republican. Most Republicans are not climate change people. There was a cobalt mine in Congo that collapsed, and people had to be ducking out of the mines, because it was collapsing on them. And he was complaining that so-called climate, this is your so-called clean energy. There's nothing clean about it. You claim it is clean because they are not doing it in front of you. But that is where the cobalt for the batteries come from, the batteries that you are putting in your so-called clean cars. So let's stop deceiving ourselves. So there's a bit of hypocrisy, to be honest. And, in this whole thing, you're doing a climate change conference, you're taking private jets to climate change, and then you're telling me I should not drive a car, I should drive a bicycle. And some of these distances are very short distances. And you know how private jets can be. You can only take very few people. There are scheduled flights that go to these places. Are you too big or too proud to enter a flight? Body flight, body plane, and go there. So that the same fuel, the same emissions that one person would use, 200 people can use that. Okay? So it is being able to deal with these extremes and meet at a good midpoint where everybody realizes that we can't continue to take the heart for granted. For the art to work for us, we also have to work for it. That is the way forward. Thank you very much.
Okay, thank you very much, everyone. I'm sorry I may not be able to take another question because we have just 4 minutes to go. And then if you would like to continue to engage in the conversation with the speakers, I'm sure we can share the presentations with you afterwards. If you sign the attendance register, the link was shared in the chat box. So please, I would like for us to please put on our camera so we can quickly take a group photograph. Please, yes, thank you, everyone. Please, let's do this.
Thank you.
Please, everyone, we're waiting for you. Please turn on your camera so we can take a group photograph if you would like to. Okay. Okay. I guess people are not ready to turn on the camera, but it's fine. Thank you everyone for joining today's webinar. We really appreciate your time. And we appreciate that you stay true from the beginning, despite that it's holiday season. We really do appreciate your time. And I'm sure you've learned one or two things in this conversation. Please continue to follow us on our social media pages to learn more and see what we do at the Center for 21st Century Youth. You can visit our website at www.c24.org. So thank you, our speakers. We really appreciate your time and the effort you put in to make a beautiful and wonderful presentations. And then our audience, thank you, everyone. And I hope that you will join us for subsequent ones if we invite you to. Thank you, everyone. Please do have a wonderful holiday and enjoy the rest of the day. Bye-bye, everyone. 2 minutes.
Thank you for having me. Thank you, everyone. Thank you so much. Thank you.